12th at Brown Acres. Enjoy a round of golf, lunch, and more, all to help raise funds for Volunteers in Medicine and Project Access. Golf for Good. Register now at vim-chat.org.
You know, there was a time when talking to someone about a total hip replacement sounded like a very frightening endeavor, but pretty much it seems to be something that most of us know someone who's gone through. Dr. Tyler Tucker is on the show with us this morning. He is an orthopedic surgeon with Parkridge Hospital. Good to see you.
Good to see you. Good morning.
So, good morning. So, first of all, welcome back to Chattanooga.
Good to be here.
I'll tell you, Tyler here is a UTC grad, did PT school here at UTC,
right,
and then pursued his medical degree, and now is an orthopedic surgeon, and life has brought you back home.
It sure has. It sure has. My wife and I moved here last summer. She's a pediatrician in town, so we're happy to be here and getting into the community and getting involved in this place. It's a wonderful place to live.
I wanted to bring up your PT side of things because I had told you off camera, I think that must give you somewhat of a different perspective, a heightened perspective when your patients come to you. You said right off the bat, you want to be a little bit conservative in your approach, not just jump in to a hip replacement.
It does. In my time as a physical therapist, I saw what patients go through pre-operatively and post-operatively, and I want patients to have that mindset that things can get better than they are now without any major intervention. But if despite those measures they're still having limitations and still not able to do the things that they want to on a day-to-day basis, then there are options for them surgically as well.
Okay, let's talk about what some of those more conservative options might look like for a second.
Right.
So let's say somebody comes in, are they often initially just hearing some like popping in their hip? What are they experiencing that brings them to you?
Most of the time, as it relates to pain that is coming from the joint of the hip, they're experiencing pain that's deep in their groin and off to the side of their hip. They're losing mobility in their hip as far as having difficulty putting on socks and shoes, having trouble with getting out of bed first thing in the morning with pain in that groin area, and then prolonged standing and walking activity is becoming painful for them as well.
So the stability part of it is concerning because that means that they're, I guess, more prone to falls and injuries. Is that right?
Exactly. And if they fall and injure something, well, then that kind of changes what we have to do for them. Yeah.
Okay, so are you seeing most people, I hate to be too generalized here, but of a certain age coming in, or are younger people coming into you too? Do workouts affect the health of your hip?
It absolutely does. There are plenty of young adults coming in with hip pain from workouts or from just physical activities that they do on a day-to-day basis with their jobs. As it relates to degenerative joint disease, most of those patients are middle-aged to early elderly patients who are experiencing that, and even some elderly patients as well.
Is there anything that we can do on a preventive measure even now before we start experiencing any hip pain?
Absolutely. Keeping our weight under control, keeping our bodies flexible and strong, those are the best things that we can do for ourselves. Working on balance training regularly to prevent injuries is also very helpful. And then there are diets that have been shown to have decreasing inflammatory responses to ourselves as well.
Like the Mediterranean diet, that kind of thing?
Some of those diets that are rich in turmeric and cinnamon and other things like that can be beneficial.
Are women at more risk than men for problems like this, or does osteoporosis play into it at all?
Osteoporosis can play into it, but as it relates to degenerative cartilage damage to the joint surface itself, that's kind of fairly well balanced between men and women.
Okay, so now here you are, somebody walks in and they say, no, please don't make me go through the conservative approaches. I've lived with this pain far too long. If it's at the point now of talking hip replacement, what are they looking at? Are all hip replacements the same?
They are not. There are a few different approaches that are used out there. There are anterior and anterolateral, and even a posterior approach that is used for hip replacement. Where I trained, we did primarily mostly anterior approach to the hip replacement. That's been shown to have potentially increased likelihood of early discharge from the hospital or same-day discharge from the hospital, earlier functional recovery as far as earlier return to walking, and an earlier return to being able to quickly get up and go from a seated position.
There was a time I remember in these conversations years past when the longevity of the the hardware was finite. They've got a long lifespan now.
They do. Most of the implants that we are using for hip replacement now are all FDA certified for 25 to 30 years. There are some patients that have them in place for even longer than that.
So if you are, let's say, in your 60s, and you're having a lot of pain and you think that'd be a good candidate, chances are if you go ahead and do it, you will be well into your late 80s or so before this needs to be addressed again?
That's the goal. You know, we don't want to get into the mortality and morbidity of things, but
Sure.
the goal is to do a good job in replacing a joint and have to only do that one time for somebody in their life.
When people come to see you, is it helpful for you to have as many records on them as you can have before they first walk through your door?
It is. We like to know their health history to see that if they do have other health issues that they're taking medications for, that those things are well controlled, that they're stable in their treatment course. And then in our office, we get x-rays to see what the joint looks like, to see if there's loss of space and bone spurs around the joint, different things that arthritis appears as on radiographs, and that helps us in our decision making.
Last thing, not to be judgy, but even if you lose 10, 15 pounds, that can make a difference?
Absolutely.
Okay, here's where you will find him. Dr. Tyler Tucker, he's back here in Chattanooga where he belongs at Parkridge Bone and Joint. There's their phone number, 493-5220. Don't let that pain slow you down anymore. He would love to be the one to get you back up and running. Great to see you.
Thank you.
We're the insiders, and winning car wreck cases is what we do.
Check out these big wins.
I injured